Good day, I am Divyah from Group 25. Today I will be talking about coercion and also clinical task 1. So first, what is coercion? Coercion is the practice of persuading someone by using force. So basically, coercion is a tool that gives staff the responsibility, possibility, and the duty to do good for a patient. There are some patients that have difficulty in assessing their needs, which sometimes may pose threat, may pose danger to themselves and also to others. So under these circumstances, medical professions and healthcare professionals do have to use care and coercion act in order to calm down the scenario, in order to keep the scenario in a more controlled state. Let's get to our clinical task scenario. So our scenario is Mrs. Grigorova is a 43-year-old patient who was in an accident and she fractured her pelvis, her right thigh, and her right forearm. She formerly lived alone in an apartment and looked in on her elderly mother. So she was assisting her mother in a living facility daily. After long hospitalization, the doctors plan to discharge Mrs. Grigorova. She cannot ambulate and has difficulty feeding herself with her left hand. Consider how Mrs. Grigorova moved through the healthcare system to regain her self-care ability. So, what kind of assistance will she be needing once she is discharged? The assistance she will be needing will be followed under a certain guideline. Assisted ambulation will be followed by using the proper body mechanics, and also you can use transfer belt to provide support and proper grasping support. Third, you could use shoes or clothing that provides proper support for the patient. Fourth, make sure their ambulation device are not worn out or not cracked. For example, canes and walkers should not be worn out. Second question is, can she be discharged to her apartment? She is living alone. My answer would be no. She needs assistance when it comes to ambulation and also feeding. So she would definitely need someone to help her out when it comes to feeding herself, when it comes to transferring herself from one place to another. Hence, living alone seems to not be the best scenario in this situation, especially when she needs more assistance. So the list of facilities in which her continuing care could be provided as question number 3 is number one is residential care facility. Why do I say this facility can be used? Is because this facility provides us with 24-hour staff requirement, as in for 24 hours there are always nurses, there are always assistants who could always aid patients like our patient here who needs care every single minute, every single time, as in for their mobility, for feeding and all of that. 2 is continuing care facility. Why do I say this facility? Is because this facility do give patient a certain independence level, but at the same time they also do provide specialized nursing assistant care within this facility. So this is also another example of continuing care location in which the patient could be enrolled in.